psychologist with a background of developmental psychology, and I have several years of experience in working with children on the spectrum such as autism spectrum disorder, ADHD, OCD and other disorders as well. Well, child psychology is mainly focuses on the children's social, emotional and cognitive development. Distinguishing it with other branches, they might be concentrate more on a wider age group or a specific mental health issue. Absolutely, it is very much important for child psychologists or other experts who's in this field for them to understand the importance of child development, because it lays the foundation for us to address and identify the possible psychological issues that the children would be experiencing as soon as possible, so that we could prevent it as early as possible, so that they can go in for the early intervention before it spikes and causes more behaviors, and for the children to acquire more of maladaptive behaviors. Alright, when we look into some symptoms of psychological issues, mainly there will be changes in the children's mood, academic performance and their behaviors as well. So primary caregivers or parents, it will be very much easier for them to identify these changes if they closely monitor their children or if they pay more attention. And this would be the red flags. If let's say if you happen to see this kind of changes that has been happening in your children, do immediately seek out for professional guidance, or just go and look out for any intervention just to see, like, what could be the causes, and is there any need for therapeutic approach to seek out and to sort out the behaviors as early as possible. I would say to ensure the environment is very much important. Do reinforce them a lot. Do not punish them for them to be on their own. Accept who they are, and also to ensure that there is an open discussion occur in between the children and the parents, for the children to freely share whatever that they feel so. Well, the answer is not exactly yes, because to become a certified child psychologist here in Malaysia especially, it requires a lot of understanding in terms of theory and practical as well. Of course, the academic need to be based in psychology, but theory, we need to understand what are we trying to deliver to the client. So if let's say if I'm applying a theoretical approach, this specific theoretical approach to the client, first of all, I need to be sure how to execute it and what are the steps and how's the consequence going to be, because the therapeutic approach may not be exactly the same for all the clients. It will be individualized. So understanding the theory and coming up to the practical is very much important, because the execution that we are doing it for client A will not be the same as what we're going to do for client B and C. So practical, of course, is different, and coming out with building rapport and how are we going to portray ourselves as a safety bubble to the client. So we should keep balance both theory and the practical. Thank you.